Okay. Good morning, Dr. Barkey.
Good morning. Great to be with you.
Thank you for joining us. I'm excited to talk with you this morning. I love talking to warriors who actually are out there fighting the good fight.
Well, thank you. It's an honor to be with you.
Uh, give our audience a little bit of an introduction of who you are.
Oh, sure. So I'm a primary care physician. I actually am in private practice. So I see patients almost every single day. And I've been on the front lines for medical freedom since the beginning of COVID, which is where a lot of people got to know me because I spoke out and tried to share my truth that ultimately led to being banned on many of the social media channels. I was one of the founding doctors that started a group called America's Frontline Doctors that I know many of your listeners are familiar with. And that was led by a brave warrior named Simone Gold. And she and I continue to work together. And so I've just been speaking out and trying to grow my audience and influence as best I can, because I just don't think there's a lot of docs that are speaking out and have the courage to do so. If your viewers are interested, I've got a pretty robust social media presence, mostly on Instagram, and that's RX for Liberty, RX, like the code for prescription, RX4 OR Liberty. And I post every day, usually a healthy tip on how to present yourself and stay healthy and optimize your health, both physically, emotionally, and spiritually. So you can find me RX for Liberty. I have a website of the same. Last year, I started a podcast with my co-host, Dr. Mark McDonald, who's a board certified psychiatrist up in the LA area, and it's called Informed Dissent. Informed Dissent. And it's on all the podcast outlets, including Apple and Spotify and so forth. And that's kind of who I am.
How long have you been in practice?
Been in practice for about 25 years now.
Okay. And you're in Orange County?
Yep, coastal Orange County is where I practice.
Okay. And well, let's start with what you think about the California legislature limiting doctors' free speech and interfering with the patient-doctor relationship.
We are talking about the Assembly Bill 2098 that was signed by the governor and went into effect on January 1st, 2023. And that allows the Medical Board of California to take the licenses away of physicians that spread the language in the bill is misinformation or disinformation. And they define those terms in the bill as anything that is contrary to the accepted medical standard of care. Now, keep in mind, there's very little standard of care in medicine. Science is all about challenging the consensus and standard of care. And interestingly, the Medical Board of California is all appointed by the governor. And the president of the Medical Board of California is an attorney, not even a doctor. So imagine for a minute the medical board equivalent in the legal world, that'd be the California Bar. Imagine that the California Bar's president was a physician, not a lawyer. Well, they would never say that, but yet here we are that the head of the organization that oversees the licensing of physicians is not even a doctor, it's an attorney. So it's that group of people that would determine if I'm violating and spreading misinformation or disinformation. And, and keep in mind that this idea of scientific consensus really only occurs when you censor doctors that are disagreeing with you. And that's what's happened during COVID. And even the CDC keeps changing their mind. In August of 2022, the CDC changed their COVID guidelines. And the COVID guidelines said that you no longer have to test people that don't have symptoms. So asymptomatic spread is not really a thing. But you need to remember that the reason why, and the whole premise behind us closing schools for almost 2 years, was the idea that little Johnny would go to school, and even though little Johnny was healthy, he could harbor the virus, spread it to his classmates, spread it to his teacher, then everybody would go home and kill grandma and grandpa. So we closed schools for 2 years, even though many of us, me included, spoke out and said, no, that's not a thing. Asymptomatic people, healthy people, those without symptoms don't spread disease. It's, you don't catch a cold from somebody that doesn't have a cold. This is just common sense. But with COVID, they told us something different. So the CDC updates their guidelines in August and says, we don't have to test asymptomatic people, and the vaccinated and unvaccinated can be treated the same. So had I spoke out, and I did early in the pandemic, and I said, no, we shouldn't close the schools. Kids shouldn't be wearing masks. They don't help. Asymptomatic spread isn't a thing. I would have been speaking against the consensus, at least the government consensus. And at that moment, I would be in violation of this law. And then they change their mind and say, just kidding, in August of 2022, and we no longer have to test asymptomatic people. So the CDC can't even get their facts straight, let alone the medical board that's run by a bunch of attorneys that are going to decide whether I'm speaking misinformation or disinformation. So I try to speak factually. I try to give my opinion and state it as such when I offer it. And most importantly, this harms patients. So if you came in to see me, in order for me to be in compliance with this new law, 2098, I would need to consider and give due consideration to the state's narrative before I could answer your question, if your question had to do with COVID. So if you said, hey, Barkey, do you think I ought to get my fourth booster? Or should I continue to wear a mask? Or I have COVID and I need treatment. Is ivermectin, hydroxychloroquine, or any of those sequence multi-drug strategies effective? I would have to look towards the state, Sacramento, understand what their position is before I could give you advice. And so that puts you as a patient at risk, because now you're no longer getting my honest opinion based on my knowledge, experience, wisdom, etc. It's very complicated.
And knowledge of the history of the patient.
100%. So you need the history of the patient, understand the subtleties of what brings them in, their symptoms, physical exam, lab testing, and so forth, before you can render an honest opinion. And it's an opinion, and that's why they call it the practice of medicine. And I've treated now thousands of COVID patients successfully, and I will continue to do so. So I've got a history of how to treat this. I read the experts, I follow the science, and we're pretty good at treating COVID. Nobody should die of COVID if we can get to you early and offer you early treatment. But even today, actually just yesterday, COVID patient called the local CVS. They refused again to dispense ivermectin as part of a sequence multi-drug treatment protocol. And so we have to use compounding pharmacies or mom and pop pharmacies that are willing to dispense this safe and effective drug. And I've never seen anything like this in my 25, 30 years career, where a pharmacy and pharmacist refuse to dispense a non-controlled substance. Non-controlled meaning it's not like it's Vicodin or Valium or Ambien or a narcotic. So it's easier, literally, no joke, it's easier for me to get you a prescription for OxyContin or Vicodin than it is for me to get you a prescription for hydroxychloroquine or ivermectin. And regardless of your belief, I'm happy to have people disagree and say, yeah, Barkey, you're crazy. We don't think ivermectin works. Fine. That should be between me and the patient with informed consent. And it shouldn't be the pharmacist who determines what I'm allowed to prescribe, especially when ivermectin has been around for 50, 60 years. It's listed on the World Health Organization's top 10 list as most important drugs. It's extraordinarily safe. It would be hard for me to hurt somebody with ivermectin if I wanted to. Same with hydroxychloroquine. Yet the pharmacies are determining how I treat patients. That's dangerous to the patients. It's contrary to science and medical care. It's anti-American. It's totalitarianism, and it's wrong.
Yeah, it's political and ideological rather than based on science. Yeah.
So that's the state of the American medical system as I had a patient in Texas a few days ago. They're a bit more lenient there. Walgreens pharmacy, I called in ivermectin, and the pharmacist asked, before I waste my time, will you dispense it? And they said, yes, but we have to read you a few things and you have to agree to them. Like, well, that's weird. Okay, what is it? Are you aware, doctor, that there's no evidence to support the use of ivermectin for COVID? And I said, no, actually, quite the contrary. There's an abundance of evidence and studies showing its efficacy and safety. Are you aware of that, Madam Pharmacist? No. This isn't for you to ask me questions. I'm required by my pharmacy to ask you these questions. I'm like, okay, so noted. I understand we disagree. Would you please dispense the ivermectin? I mean, this is what you have to go through, and it's crazy.
Yeah.
Never heard a pharmacist say, are you aware, doctor, that Vicodin can be incredibly addicting and can kill people, and it's very difficult to get people off? Maybe they should say that.
Well, what do you think is the motivation for fighting against ivermectin and trying to control the messaging and control doctors?
Yeah, I can't really get into people's heads to know, but it's hard not to believe that there's strong financial motivations at every level of government that's pushing this false narrative. Ivermectin and hydroxychloroquine are generic and cheap. The government just recently purchased an additional, I think it was $2 or $3 billion worth of the new Pfizer drug called Paxlovid or Paxlovid. Keep in mind, Pfizer's vaccine is failing, and they have the gall to now advertise a treatment for COVID called Paxlovid. And the government has paid for this stuff, something like $20 billion to provide this to the various pharmacies. I posted on this on my Instagram yesterday. Don't believe me, by the way. Simply Google package insert for Paxlovid, and what you'll notice is in there they list 38 specific medications. And Pfizer says, and now I'm paraphrasing, something like, if you're on any of these medications, it could be dangerous to take Paxlovid. And then below it, it says, this is not the entirety of the list. So be sure you check in with your doctor to make sure that there are no drug-drug interactions. And then they go on and list a whole variety of side effects. And they indicate that you can use this drug all the way down to 12 years old. I mean, keep in mind, kids do great with COVID. They rarely even need treatment. And so this drug is being used under emergency use authorization, emergency use authorization, EUA. And definitionally, what's required is two things. There has to actually be an emergency. There is no COVID emergency in America, at least not anymore, especially with children. So there's no reason for this drug to be approved. Second, under EUA, you have to have no alternative effective treatment. Well, that's not true. We have excellent effective alternative treatments. And there are multiple protocols out there. Peter McCullough has created a protocol. Brian Tyson, the COVID king of the United States, has his own protocol. He's a doc in El Centro, California. And he treated something like 20,000 COVID patients. Hasn't lost a single one that gotten too early in the course. So there are treatment protocols, FLCCC, Frontline Coalition for COVID. I can't remember what it stands for. And that's Paul Merrick's site. And he lists all the evidence for the various protocols and treatment recommendations. So there's no question there are excellent treatments that are available. No reason for Paxlovid. And by the way, the same thing is true with the COVID vaccines. Still being used, all of them. There's not a single approved vaccine that's available at the pharmacy. They're all under EUA, now all the way down to 6 months of age. There's not anything even close to a COVID emergency. Right. You could argue there's an emergency giving a COVID shot, that the jab in kids is far riskier than COVID itself. Not my opinion. Look at the CDC's data. I do this regularly. Google this. CDC death by age, COVID. And it's something like 1,400 less than 18-year-olds have died throughout the entire pandemic. We're now 3 years in of COVID. Statistically, if you do the math, and many have, there's so many zeros after the decimal point. It's a statistical zero risk of death.
Right.
Less than 18 with COVID. That's not an emergency, but
No.
there are people dying of cardiomyopathy and pericarditis, myocarditis from the effects of this COVID shot. So in my, no child should ever receive a COVID vaccine. Why would you vaccinate a child against an illness that they're not at risk, using an experimental product that has no long-term safety studies? Or are we out of our mind? The good news is parents, generally speaking, are following this type of advice, and the number of kids that have been vaccinated less than 18 are very, very low, and thank God for that.
Well, there's been so many adverse reactions, even with adults, that I think a lot of people know somebody that's had a stroke or a heart attack or neurological problems. And in our family, we have a young man that was in the military and got vaccinated because he was in the military, 32 years old, 2 kids, married, very healthy. And within about a week of getting the shot, started having problems and now is in a wheelchair forever.
Yep. I have vaccinated people in my practice as well.
Yeah. So that's one of the other problems, has been informed consent. You know, if we haven't really had informed consent because we don't know what's in the shots. And people that...
Informed consent really is a concept that says, what are the risks? What are the benefits? What are the potential side effects? And what are the alternatives? And that's true of any medical procedure, vaccination, medication that you give. That's the basis of informed consent. And unfortunately, informed consent simply is not happening with this vaccination, with the medications, Paxlovid. I know plenty of people that they've gone on Paxlovid. They call me up and they're on a statin, for example. That's one of the 38 listed in the package insert that says, don't take this product if you're on a statin. Don't take this product if you're on a blood thinner. And I have patients that are on statins. Pharmacists never ask. And they have side effects or they have a rebound phenomenon. And so it's, in my opinion, it's not a safe enough medication to be putting patients on, and it's certainly not effective. There's a study out of New England Journal that showed if you're less than 65 years old, Paxlovid really offers you no benefit. The benefit Pfizer claims is it will prevent you from the COVID from escalating. And less than 65 years old, the New England Journal study showed it's not a thing. There's a study out of Circulation that showed it's only about 46% effective, whereas the original studies showed something like 90% effective. So real data, real population studies show this medication just simply is not effective. So I don't prescribe it or recommend it. I do recommend a multi-drug strategy with pharmaceuticals and nutraceuticals to treat COVID. And ideally, we get to you very, very early. That's the best chance we have. Like other illnesses as well, you get to people early, and we do a pretty good job of treating it.
In our family, when we get COVID, right away we start on the protocols that we get from frontline doctors. So
for sure.
So we've used ivermectin and hydroxychloroquine and vitamin D and C and zinc and all that.
Yep.
So it's been really helpful, and our symptoms have gone away pretty quickly, like within a day.
Yeah.
So we've had really good luck with it. And then, so back to the shots. Do you have any idea what's in the shots? Can you tell us? I've been listening to doctors and scientists who are talking about what's actually in the shots.
Yeah, I'll tell you, Julie, there's a lot I know. There's a lot of opinions I give. There are areas where I'm not an expert and I don't like to speculate. And there's a lot of conspiracy theories out there that may or may not be true, but really aren't in my wheelhouse. My goal really is to influence people that maybe are just left of center or questioning what's going on and they want some solid information. And I've heard various of my colleagues talk about what's in the shot and graphene oxide, and some batches are saline and some batches aren't, and speculation all over the place. I don't really have any knowledge about that, so I don't know. I think there are more important messages that I try to relay, specifically about the importance of early treatment, about informed consent and the risks that we know of the COVID-19 jab. I don't think we should continue to call it a vaccine, because it's not a vaccine. At best, it's a genetic biologic therapeutic. It's the first time, I think, in history that we've ever put a product inside a human body, asking the machinery of the body to produce a non-human protein. Right. When we give a traditional vaccine, pick your vaccine, tetanus shot, MMR, whatever, regardless of what you feel about the various vaccines, what we do is we use a tiny amount of, like the flu shot, an attenuated flu virus. We put it in the body sees the virus and then reacts to it and produces antibodies and so forth. This is the first time we've put messenger RNA into the body and asked the immune system to create a non-human protein, the spike protein. It's not a human protein. It's a man-made artificial protein that was cooked up in the lab in Wuhan, China, by the Chinese Communist Party with our taxpayers. So this is a virus that was created with gain-of-function research. The only question is, did the communists release it purposefully, or was it an accident? I don't know what the answer is to that. But so we put this product in the body and we ask our immune system to create a non-human protein, the spike protein. Well, that's really weird, because then the body sees non-human. This is Winston Churchill. He likes to get in the camera. So the body is now producing a spike non-human protein, and the body says, holy crap, this is not human, so we're going to attack it. And so I think on some level, the body starts attacking our body's own immune system. It creates an immune dysregulation. And that's why a lot of people that have had multiple vaccines now are having difficulty fighting off routine coughs and colds. We're also seeing evidence that the more vaccines you get, the more boosters, the more likely it is that you're going to get COVID, the more likely you're going to die, end up in the hospital or the ICU. There's studies that are now showing that signal. Pfizer is even coming out showing signal of injury. So listen, in my opinion, I no longer can recommend this vaccine to anybody, especially children, but anybody. I never used to think that. I used to think, well, listen, if you're an old person and you're at high risk, maybe it makes some sense that it prevents, bad outcomes. And so it doesn't prevent you from getting COVID, but maybe it prevents some bad outcome. But I can't even recommend that anymore with what I'm learning about the signals of injury that's going on. And yet the government continues to push the vaccine. I've seen advertisements, pregnancy, get COVID vaccinated when you're, that's friggin' insane.
Yeah.
We have no proof safety during pregnancy, and get your 6-month-old vaccinated.
Yeah.
Crazy town. Nobody should be doing that.
Yeah. Well, the other thing is the studies show that you have a negative immunity to COVID after 3 months after you get the shot. At 3 months, you're in worse shape than before you got the shot as far as immunity.
A lot of people have had natural COVID. I did. It's been like a year now, 2 years, I can't remember. So we know natural immunity is robust, broad-based, long-lasting. Vaccine immunity, at best, you're right, 3, 4, 5 months maybe. We also know that if you have natural immunity, getting a vaccine on top of your natural immunity, you're more likely to have side effects as well. So listen, this is a failed vaccine, not even a vaccine. Doesn't stop infection, doesn't stop transmission. Early treatment works. You need to have access to early treatment. That's the key. And if you just make yourself a simple nose, throat rinse solution and did nothing but that would help you. 6 ounces of water, a splash of food grade hydrogen peroxide. The first sign of any symptoms, you snort it up, spit it out. Do that every few hours to kill the virus in the back of your nose and throat. Do that, and you'll be in better shape. And then make sure your vitamin D level is at the upper limits of normal.
Do you recommend povidone iodine as well instead of hydrogen peroxide or
Either
in.
one is fine. Providone iodine
Oh,
is betadine, that brown liquid we clean the skin with. The problem with betadine is if you spill it on your shirt or your clothes, it
yeah,
stains.
it's gonna stain.
So that's the
Yeah,
only thing, but it works well
yeah.
too. I
Okay.
just prefer hydrogen peroxide because it's clear, it's a little bit easier to work with, and it doesn't get all over the place.
So are you are you in a lawsuit with the state of California
Not the
over
same
AB
California, but
2098?
Dr. McDonald and I, represented by Liberty Justice Center, sued the Medical Board of California and the Attorney General to try to prevent this AB 2098 from actually coming into effect. We had a hearing before a judge. The judge basically denied our request, and now we're appealing to the Ninth Circuit Court of Appeals, and we will hopefully keep the pressure on them and work our way up the chain as high as we're allowed and our lawsuit will go. There's other organizations that are suing too. So Children's Health Defense, that's Bobby Kennedy's organization. I'm
Sure.
a board member of the California chapter of Children's Health Defense. And Children's Health Defense is also involved in a lawsuit against 2098. And there are other organizations as well that are suing and using, different legal avenues to sue. And hopefully one of us will prevail to stop this law because we believe it's unconstitutional. Not to mention that it's just simply anti-American and totalitarian. So we'll see what happens. I'm not overly optimistic, but we'll keep our fingers crossed. Anybody that wants to support the effort, you can do so actually twofold. One, follow me on Instagram, RX for Liberty. I also have a subscription side of that, $4.99 a month. It's no big deal, and I post content every day. You can also go to Liberty Justice Center's website. They have a donate button. They're a pro bono law firm, meaning Dr. McDonald and myself, we're not being charged to be represented. They do this for free, and they get donations is really how they survive as a pro bono lawsuit. So you can go to Liberty Justice Center and hit the donate button. And anybody that wants to follow me is greatly appreciated as well.
Okay, that's great. Um, I'd like to also go through all the things that we were told originally that through real science we found that just were not true.
Oh boy, there's
So, yeah, like the one of the things that we published was the Great Barrington Debate. Is that what it was
great,
called?
great declaration.
Declaration, that's it.
Martin Kulldorff, Jay Bhattacharya, and
Hmm.
I forget the lady's name out of Oxford.
Yeah.
And Dr. Bhattacharya has become a friend. He considers himself a frontline doc. Look him up, man. The guy's incredibly credentials, MD, PhD at Harvard. These are really brilliant thinkers that were banned on Twitter and other social media. They formed an organization out of Hillsdale College, and it's like a Center for Healthcare Freedom. That's not the name, but it's something like that. It's really a Hillsdale College sponsored think tank to promote medical freedom. Dr. Gold and America's Frontline Doctors that I'm part of as well. We're also involved in that. And by the way, to your audience, there's been a lot of trash talking about Dr. Gold. Don't believe it.
Yeah,
They're
right.
trying to take her down. They're calling her anti-Semitic. Super interesting because she and I are both Jewish. They're calling her a pawn for Israel. They're saying she embezzled frontline doctor money. All of these are lies, and they're trying to take down her and the organization. So don't believe it.
Yeah, and they have almost 1 million signatures worldwide. I'm
Yeah,
looking
they're
at I'm
great.
looking at it.
Simona's doing great work. She created an organization called Gold Care. It's a nationwide telemedicine platform to provide patients with an alternative mechanism to get care independent of any government money. And so I'm helping her with that. We hope to also roll out some brick and mortar medical clinics that when patients actually physically need to be seen, they can go there as well. Again, no insurance, no government insurance involved. It's all healthcare freedom. And it's amazing the amount of waste. You pay thousands and thousands of dollars for health insurance. Almost all of it goes to bureaucrats. Very
Right.
little, very little of it goes to a doctor. So if the patient comes in and they have blue whatever insurance, and I see them for a sore throat, cough, cold, whatever, and I bill, most of the money that you paid isn't going to me. I might get $60 or $70 after several months of trying to collect on your insurance. It's ridiculous, and it's ruining healthcare. So Dr. Gold's idea is, let's get rid of all insurance and let's do direct primary care. You pay the doctor for their time and their expertise directly, not through an insurance company. And then you have an umbrella insurance product, like one of the medical sharing companies. People are probably most familiar with MediShare, and we're partnering with one like that. So you have fairly inexpensive catastrophic coverage in case, I don't know, you get in a car crash and you need to spend time
Sure.
in the hospital. But for most of your care, you pay, and you end up saving a lot of money, and you get actual opinions from doctors that only have your interest at heart. Too many doctors now are employed by big hospital groups. So when you go there, they can only refer to the hospital group. They can only refer to doctors that are part of their network. You can only get x-rays, labs, and ancillary services at their network. And so it's a captured organization with all kinds of conflicts of interest. If I'm not getting a paycheck from you as a patient, and I'm getting a paycheck from some third party, then
Right.
have my ear, they have my interest, they tell me what to do, not the patient. So working directly for the patient, we're used to this in the legal world. If I hire an attorney, I pay that attorney a retainer, and then that attorney works directly for me, not for some third party. And doctors should be using a similar model. You pay me for my care, for my opinion, for my time, not some third party where that money then trickles to me where I have a conflict of interest.
Yeah, I just object to the government having the say-so of how I'm treated when I've got a relationship with my doctor that I may have had for 20 or 30 years, especially.
That's right. If the government doesn't like what you're doing, they can come after you, whether you're a Medicare provider or
Right.
you're under the umbrella of a medical board in your state, like I am in California. If the California Medical Board doesn't like what I'm saying on this platform, on your podcast that you're broadcasting, they could say, Barkey said he doesn't recommend the vaccine for anybody. Well, the government recommends the vaccine all the way down to 6 months. Therefore, he's spreading misinformation. That's dangerous to the patients, that they can't get honest opinions from doctors that they trust.
Yeah. I'm embarrassed for journalism that there hasn't been more of an outcry over this as well, because journalism depends on free speech too. It's a
Yeah,
problem.
I agree with you.
Yeah. So, where do we go from here? For one thing, I know we have so many. I just read Eric Dowd's book, um, Cause Unknown, talking about injuries from the jab, and so I'm wondering, where do we go from here? Are there protocols that people are creating to try and use our natural immunities to heal from the damage that's been caused by the shots?
Yeah, I was with Eric Dowd a couple of weeks ago. For your audience, if you haven't read his book, it's worthwhile, or to follow him.
Hmm.
He's a former Wall Street guy. I think he worked for Blackwater.
Yeah,
Yeah,
BlackRock or Blackwater something.
You're right, BlackRock. Anyways, made a boatload. Um, Believed what most other people believed. He was a man on the left, fully vaccinated himself, and then he woke up and he started seeing injuries and so forth. And he's such a brilliant mind and thinker. He did a lot of research, and he came to the conclusion that this vaccine is not safe or effective, and that there's a lot of malfeasance and shenanigans going on. So where do we go from here? We go back to where we started. America was created as a self-governing society. where the government was supposed to be small and was supposed to simply enforce a few of the rules to make sure that we all got along, but that it was up to you and me to take care of ourselves and our neighbors. We need to get back to that. We need to take control of our health, of our education, and our lives and be self-sufficient. We need to stop looking toward the government to help us in any way. And from a medical standpoint, we need to trust that God gave us very healthy immune systems, and we need to learn how to support those immune systems, how to get the toxic waste out of our bodies, to stop drinking tap water, to stop eating fast foods, seed oils, vegetable oils, sugar, unhealthy fats, and get back to some of the basics that I try to teach on my Instagram site, RX for Liberty. And finding a good doctor is not easy, but you should seek that out for sure, somebody that you trust. Even alternative care like naturopaths and chiropractors can be very helpful. Functional medicine doctors. If doctors automatically just want to prescribe a prescription for you, you should run. My goal is to get patients off prescriptions, to look for natural ways to treat illness and disease, to allow our God-given immune systems to function, and almost always it does. And pharmaceuticals should be a last resort, should be the last thing we reach for when we're treating illness, including just common coughs and colds. I can't tell you, Julie, how many times I get a phone call from a patient and they say something like, I just woke up this morning and I have a sore throat. Can you call me in a Z-Pack? There's variations on that, but that's really common. I've been sick for a couple of days with a cough and a cold and a stuffy nose. I'd like to start on Augmentin to nip it in the bud. And I've had to retrain a lot of my patients to say, no, that's a really unhealthy thing to kill your gut bacteria, develop resistant strains of bacteria. You need to support your immune system. And I have a whole list of things that I recommend, from steam baths and pushing fluids and coconut water and manuka honey, etc., to support your immune system. And be patient. It can take a few weeks for your immune system to work and to get you better. But if we can get you better without pharmaceuticals and without antibiotics, it's always the way to go.
And then you're stronger and you've got a better immune system.
That's correct. Absolutely.
So are you concerned about speaking out, like right now, the way we're doing now?
Of course, of course I am, but I'm not going to stop. God put me on this reason, and it wasn't to be quiet. I have a voice, and yes, I'm concerned. I also have a license in Texas, a medical license in Texas. I'm not going to move there. I don't want to. California is my home. And California Medical Board comes after me, I'll fight it to the best of my abilities. And I know there are a lot of doctors that will support me. And I have rights as well to defend myself, and I will. It may happen, but I'm not going to stop speaking out. I've got to keep doing what I'm doing and helping as many people as I can.
I've been doing some pieces on the CDC because people will say, why would the CDC lead us astray? Why would the FDA, lead us astray? And we know that there's a revolving door between those agencies and big pharma, and also the funding sources. The CDC and the FDA are funded. And that was one thing that you talked about during a talk that I saw recently that you gave.
Yeah, I think we're out in Fallbrook, and as made famous by the Wall Street, the Watergate reporter, what was his name, where he said, follow the money.
Right.
If you follow the money of the CDC, it's unfortunately a captured agency, meaning about 50% of the funding from the CDC and the FDA come from the industries that they're supposed to oversee. And it never used to be that way. CDC and FDA funding should be 100% from taxpayers. They're supposed to have the back of the American people, but unfortunately, it appears that they have the back of the pharmaceutical industries that they oversee. So, I think there should be a church committee-like investigation in Congress. Look at what happened during COVID with the CDC and the FDA, National Institutes of Health, Anthony Fauci, et cetera. And those industries should be defunded, at least defunded from the industries that they oversee. Their funding should come only from taxpayer money. And the people that work there should not be allowed to lobby on behalf of pharmaceutical industry. They should not be able to allow their work in government and then go to work for these pharmaceutical companies, and vice versa. And that's happening all the time. So it's unfortunate, and I don't say this with any joy. You know, millions of American people are now looking at these agencies with great skepticism. They don't trust the CDC or the FDA. And when the Advisory Committee for Immunization Practices, ACIP, told the CDC recently unanimously, 15-0, recommending that the COVID shot be given all the way down to 6 months of age, with very little debate, very little science presented, you just shake your head and you wonder, what the heck were these people doing? How possibly could they recommend that a 6-month-old receive a investigational biologic therapeutic genetic drug that has no long-term safety studies for a 6-month-old or any child that isn't even at risk of COVID? How could they possibly do that? And it makes no sense. So there's a lot of splaining that these organizations need to do, and I'm hopeful once this new Congress is seated and sworn in, they'll start doing some investigations.
You know what? I need to take just a 10-second break and grab my cord, which I thought I had. I'll be right back.
Sure.
Oh, there it is. Who was the vaccine doctor? Dr. Off, I'm trying to remember. I think he's from La Jolla, or he did. But I know that he's been on the opposite side of Dr. Kennedy, or Robert Kennedy, in court cases and all.
Bobby has offered, and so has Steve Kirsch. Steve Kirsch, the Silicon Valley he's the dude that invented the optical mouse. He's got a great Substack.
I support him.
And so he's offered $1 million to anybody that will debate him on the opposite side, and nobody has stepped up. Bobby Kennedy has done that as well. He'll offer enormous amounts of money for anybody to debate him on these vaccine issues, and nobody will step up. The other side just simply doesn't want to confront the facts. They don't want to debate. Listen, I don't mind if I'm wrong. If somebody points out factual evidence that says I'm wrong, I'll change my mind. But I don't think that's the case. The evidence is growing that these vaccines are unsafe and ineffective. The evidence is growing that these repurposed medications as part of a multi-drug sequence protocol works. There's a wonderful expose in the Epic Times. And I forget the title, but you could Google it, something like A Case for Ivermectin. And it just showed the enormous amount of evidence supporting the use of this repurposed medication for the treatment of COVID and other things as well. It's almost like a wonder drug. And so nobody wants to debate it. They just want to silence people that disagree with them. And it's very unfortunate, and it's anti-science, in my opinion.
Well, I know it's Dr. Paul Offit that I was trying to think of his name. He's one of the experts who advised the FDA during the vaccine process and approval.
We'll call him up. Get him on your.
But I think even he recommended against giving the vaccine to children.
Okay, good.
Yeah, I think so. And you brought up the Epic Times. We have a relationship with the Epic Times, and we have people that get really angry at us because we use their journalism. But looking at it objectively, the Epic Times has done a great job, and they've been on the forefront of a lot of these things the last few years that the mainstream media has just been wrong on. I mean, they've now been found wrong.
I agree. Yeah, I mean, 3 newspapers a day: Wall Street Journal, Epic Times, and I live in Orange County, so the Orange County Register. And Epic Times, one of the things I like about it, not trying to push the newspaper, but I think it's an excellent product, is they have a weekly section called Mind and Body, and it's all about holistic health and alternative care.
Yeah.
Co-authored some pieces in there, and I know many of the journalists that write for them. And it's my go-to to learn a little bit about things that I was never taught in medical school, like nutrition, and supplements, and vitamins, and minerals, and so forth.
Yeah, I think they're very professional and they've done a great job. And the fact that some of the people that started it are Falun Gong members, I don't understand why that makes any difference, but also the fact that they're Chinese people that fought communism and escaped it and came here and have been, you know, they've had their offices raided and burned and all that is a big deal. I mean, they understand the dangers of communism.
Yeah.
And I think we're just starting to wake up to that. Well, that was about all that I wanted to cover with you. I don't have anything else on my notes. Do you have anything else that you'd like to? You did you mention your website? I know you mentioned your Instagram and all that in your podcast, but you have a website too, right?
I do. Same name as my Instagram, RX4Liberty, RXFOR Liberty.com.
Okay. And when is your next is your court date coming up? You're in appeals?
We're waiting for the Ninth Circuit to accept our appeal, and then we'll have a date.
And do you have any hope of the Ninth Circuit?
There's always hope, but if the Ninth Circuit turns us down, then we'll appeal up the chain of command, and ultimately, if we need to get to the Supreme Court and they're willing to hear our case, then that's what we'll do.
Yeah, I would imagine that there's health professionals all over the nation watching this case to see what happens.
I would hope so, because unlike Las Vegas, what goes on in California is going to spread across the country. There are other medical boards and states looking to impose similar laws to silence physicians that want to speak out against the government narrative.
Scary, very scary.
Very much so.
All right. Well, thank you, Dr. Barkey. I really appreciate your time, and we'll make sure to put your ways people can support you and contact you and all that.
Yeah, thank you, Julie. I appreciate you having me on, and be sure to send me the link once you post it.
I will, and the news
All right.
story too. All right. Thank you.
You take care. New Year.
You too. Bye-bye.
Okay, bye.